If you've got spring fever, Lowe's has the cure. During SpringFest, make your landscape stand out with 3 free bags of Miracle-Gro 3/4 cubic foot garden soil when you buy 3. Plus, get up to 40% off select major appliances to keep clothes, food, and dishes fresh all season long. Our best lineup is here at Lowe's. Valid through 4/22 while supplies last. Selection varies by location. See Lowe's.com for details. Soil offer excludes Alaska and Hawaii.
Listen, all you New Yorkers. Taxi.
Okay, man, we're looking around.
This is the 77 WABC minicast.
Well, Sunday morning. With us is Dr. Peter Michalos. Live long and prosper. And he discovers new ways to make sure we live to be at least 100. Dr. Peter, what's up today?
Well, today, John, we're going to talk about a very important topic, and that's the key blood test to diagnose and track our cardiac health, because our heart is there from the first time before anything else starts. Our heart is pumping, and basically there's like 60,000 miles of blood vessels, veins, and arteries that feed about 36 trillion cells of ours and feed our brain and our arms and our legs and our thinking and our vision. It all has to do with the pump. And without that, we have a big problem. So getting heart evaluation is very important. And of course, the heart is electrical. It fires an electrical impulse, which causes the muscles to contract, and that's how the electrocardiogram was developed. And when you see changes on the electrocardiogram, it can tell you whether you have something called ischemia or abnormal blood flow. But before it even shows up there, blood tests that we have now, they're called biomarkers. They can find things out much earlier. And we now know from looking at people who are healthy and people who've had heart attacks that, of course, number one test is the lipid panel, and that measures our total cholesterol. Our LDL, which is the bad cholesterol, and the way I remember it is LDL is the lousy cholesterol and HDL is the happy cholesterol, and that's the good cholesterol, which you want to be elevated above 40. And then you have the triglycerides. And abnormal values, they can basically give you a notice if you have increased risk for coronary artery disease. Now, you can also, they have a breakdown of lipoprotein particles, like they have one called the LP-little-a, and that one assesses the genetically influenced the lipoproteins that increase your risk of premature heart attacks. So some doctors follow that. But one of the most important markers, I mean, for me personally, if I had one marker, it's the apolipoprotein B, and you want to keep that below 100. Europe, they use that a lot, because it actually quantifies the number of atherogenic, meaning the clot-producing particles in your blood, and it offers a more precise risk assessment than just LDL alone. Then, of course, we've talked about on this show how important it is to keep your inflammatory markers like the homocysteine levels and the C-reactive protein, and those are very important to keep, not only for inflammation that contributes to plaques in the heart, but in general for the whole body inflammation. And of course, one of the biggest things that affects everything is our fasting blood glucose and our hemoglobin A1C, which tells us our blood sugar control and the average that it's been the last. If you can keep your sugar under control, you basically don't glycosylate, which means you don't sugarcoat your nerves, your blood vessels, and that's what it does. It's called glycosylation. The sugar, extra sugar, starts affecting tiny blood vessels and circulation and can lead to more heart attacks and strokes. So blood sugar control is probably one of the biggest major contributors to heart disease. So especially if we're diabetic, we have to do our best to try to control that and keep that within normal limits. So these are just some of the tests that we have, and it's important to control our blood pressure, because we now know that when your blood pressure's up, your blood vessels say, hey, I can't take it anymore, and they get narrower and thinner.
What is, I get so many reports on blood pressure. What is considered, what's the range of normal, the top one, and the range of the normal bottom one?
Well, the top one is usually around 120, and depends on your size, your weight. Like if you're a really tall person, you might need, because like I'm 6'7", so I need to run when I'm standing. I need to run a little bit higher pressure to bring up the blood to 6'7", just like a giraffe has to pump the blood up really high. If you're very thin and very short, for example, you might have different blood pressure requirements. But the average in general is about 120/80. The top number is systolic, and that's when your heart is actually in the contraction phase and it's pushing the blood and rushing it through the body. And then what your baseline blood pressure, the bottom one called the diastolic, is during the resting phase of the pumping. And that also tells you a lot, because if it's high in the resting phase, it means you have a problem. And of course, things that we tell people are that things like sugar, processed foods, excess caffeine, and various stimulants, some drug use that people do, people who do cocaine, for example. I remember being an intern at New York Hospital at Cornell and seeing 25-year-olds with heart attacks because they take cocaine. That raises your blood pressure suddenly, and that's when you can cause heart attacks, strokes. So you want to stay in the 120/80, and natural things that you can do.
And then what number is it considered high? Above a 140, maybe?
Yeah, over 140, it's considered high. And you have to be careful, especially during pregnancy. You can sometimes get very high blood pressures. But we now know it's also one of the biggest risk factors for Alzheimer's, because they found that when people's blood pressure is high, the vessels in the brain can't take the high pressure, and they start getting narrower. And when they become narrower, it's like having, instead of a garden hose, having something as skinny as a straw.
Now, is there such a thing as too low?
Yes, you can get hypotension, and some people get what's called orthostatic hypotension. When they stand up, it goes too low, and also certain.
What's considered low?
The side effects. What's considered low is like 90/60, and then your brain has trouble. That's when you want to lie down, or you start feeling like you're blacking out, because your brain, which sucks up 20% of all the blood flow, doesn't get enough oxygen. It gives you a warning sign. That's why we want to lie down, or we feel like passing out. We lie down, we elevate the legs. Why? To bring more blood back up to the heart and to feed the brain so you don't pass out. So we're basically like a fine-tuned machine, and we have to find the balance.
Understood.
Monitoring your blood pressure is very important, and keep listening to WABC for more health tips on living long.
Well, God bless you, and thank you for keeping so many of our listeners alive and going well, and we'll catch up again soon.
Thank you, John, for always getting the truth out. You can learn more on our X at Death of Aging, as our new book comes out this May, The Death of Aging.